In the Black Country, it is reported that approximately 198 people are currently homeless, although the true figure is widely regarded to be much higher than this by services working on the front line.
Across England and Wales, the average age of death for people experiencing homelessness is 46 years old for men and 43 years old for women, more than 30 years below the national averages for the whole population.
People sleeping on the street, or street homeless, are almost 17 times more likely to have been victims of violence. People experiencing homelessness are over 9 times more likely to take their own life than the general population. Homelessness is not a lifestyle choice. Homelessness is devastating, dangerous and isolating. The Black Country Integrated Care Board has worked with a local voluntary, community, faith and social enterprise sector partner, Good Shepherd, to capture the lived experience of several local people.
When you're in the thick of it and you're waking up behind a shop or in a doorway, it's not the best start of the day.
I've got a 13-year jail sentence for drug offences, spent a couple of years street homeless living in Birmingham on a car park, shoplifting every day, you know, and it was quite dark, very isolated, very alone, a lot of hatred of self, you know, what have I become? You know, I knew right and wrong growing up, I was brought up very well, and I just ended in a place of just no hope and really very, very dark and alone, you know. It wasn't about, you know, I didn't want to live, too scared to die, you know, and that's where it sort of took me.
You always get this look of a homeless person that they seem just drawn and you know, drained, and that's what it does here. It's just because every day is a constant battle. Food, shelter, warmth, you know, and unless you've got somebody like an organisation like the Good Shepherd behind you, you're not going to make it. You're not going to do it out there on your own, because it's just, and this is another thing about the street, it's dog eat dog out there. You'd think you'd find compassion. This is the only place you're going to find compassion. It's not out there on the street.
At the time I was on the street, homeless, and,
Yeah.
you know.
What put you in that position to begin with? What?
To be honest, it's probably like when I lost my flat and on the street, like,
Yeah.
so. Like I said, I have a CPN, like,
Yeah.
I see once a month, like, just
Yeah.
to see how I'm doing and that. Like.
Yeah. And you're
Yeah.
happy with that?
Yeah, I'm okay.
That's enough,
with that,
yeah?
yeah.
So what would happen, do you remember? Because on a night time, you'd only be allowed to stay until you couldn't go back out up till 10 o'clock.
That's right, yeah.
So once you was in there, you'd want to smoke again after 10 o'clock.
Right.
So you'd get up and you'd come out. But once you was out, we couldn't let you back in again.
That's
So
right.
then you'd come out into this bush here. Do you remember it? There, that's exactly where you used to sleep, in that bit
right
there.
over there.
Yeah?
Right. Yeah, so,
So you'd come out and get in here,
right.
and I'd come out and this would be full of rats, and I'd try and wake you up and ask you to get up, and you wouldn't. I remember the morning we came back and you'd been bitten, and I remember finding you and your head was oblong, like a real, we'd found the ambulance, but unfortunately the ambulance wouldn't take you because you were saying what you didn't want to go.
I mean, that was the day on my birthday.
I think it was, John, yeah, I think it was.
Because
Yeah.
he came and
Yeah.
tried to get me out.
Tried to get you out the bush, wasn't it?
Someone's mum moved,
Yeah.
I couldn't really move, like, because, you know,
Yeah.
because the rats bit my
Yeah,
foot, like, you know, sort of thing.
Yeah. Yeah.
Like I said, if it wasn't for the night shot to slap on,
Yeah,
I wouldn't be here now, like.
No, John, no.
Because I was taking the number and couldn't move or do anything, like, so, you know, until Katie came and saw me in the bush, like,
Yeah.
like, you know, so.
What worked for you? What was the changing point, John? What was the actual changing point for you?
Coming back to you guys, like, at the Good Shepherd.
Yeah.
uh,
And just getting the support,
That's the,
and then getting the accommodation, and just moving on, and your medication, getting your medication right as well.
Right,
Yeah.
I think a lot of time people from inclusion health groups are excluded subconsciously or unconsciously by services by the way that they're designed. A service will make an assumption about a person that they've got an address to send a letter to, or they've got a mobile phone that they can be contacted on. And it's these additional barriers that are put in place for people to access who are homeless that services don't even really consider. Also, I think there's a lot of stigma and negative past experiences that people who are homeless have of going to hospital, going to the doctors, to treatment services, and those past negative experiences just can make them a bit more, I don't know, we tend to find a lot of people accessing the Good Shepherd will end up delaying things, not going to see the GP, not accessing primary or secondary care, and going straight to accessing emergency care, just putting off for managing their health, whether that's physical or mental health. Obviously that ends up with much sort of greater impact to the person's health, poorer health outcomes for the patient, and also a higher cost to the NHS and services.
Throughout my time being homeless, there was a lot of times I had medical issues, so I had to go to the local hospital. I think only because I was homeless and I didn't have an address, I was treated different. I'd say I was treated a little less respectful than other people, but I guess that's part and parcel of you know, it's the whole kit and caboodle of being homeless.
A lot of the stuff that we do is try to remove some of the barriers for people who are accessing our services. So trying to make it as easy as possible for them to get to appointments, or the kind of gold standard for us is bringing services here to the Good Shepherd. So we've worked with a wide range of health partners across the city to bring in things like the opticians, the specialist dental team, TB nurses, the Hep C clinics, sexual health screening. We did a lot of work around COVID as well with COVID vaccinations, and we've got an upcoming event around cancer screening. So for us, bringing agencies on site, we can say to that person, you might have had negative experiences in the past, but come and see someone here in a place you feel safe, positive environment. We can introduce you to the worker, and we can remove some of those barriers to engagement.
I've been on wards, and some of the things I hear, they make your toes curl, you know, about our certain client base. You know, and but there are some people who really do understand. You know, these people have been through it. You should never judge them. You've never walked in their shoes, you know, until you actually get down and start talking to them. And I love that. A lot of times they don't get listened. Nobody listens to them. They get talked at. Do you know what I mean? A lot of the time all they want is a little ear, you know. So when you've got a nurse who's loving, caring, compassionate, sits down, asks how they are, sits there and listens, actively listens, you know, and means it. It means the world to the patient. Things are changing, you know, and they are getting better, but it just takes time. You know, I mean, we've had patients who missed appointments. You know, there's no thought about where this patient lives or how they're going to get to the hospital, but they've been given an appointment by the hospital to come in to see the nurses. And these couple of people I'm thinking about now, you know, they live 2 bus rides away. They're street homeless and got no money. They miss an appointment. Next thing you know, they're sending out letters. The letters sort of read, you know, you've wasted my time, you've wasted NHS money, you need to make better decisions. Imagine if you got a letter like that from the hospital. Would that want you to come back and engage with an hospital? No. You know, so we sort of had to sort out what letter, we sort of had to stop all that, because that shocked me. You know, I mean, would you send that to a cancer patient? No, you wouldn't. You know, you really wouldn't. And so now the letters sort of state, you know, we know you missed your appointments, you know, is there any way we can support you in getting to the appointments? You know, we're here for you when you're ready.
By working together and addressing it at the earliest stage, we get the best health outcomes for the patient, we reduce waste and cost to the NHS, and it also creates that partnership work between third sector, lived experience and the healthcare system. And I think that's absolutely invaluable for those reasons.
The Black Country has a shared approach to championing health inclusion and tackling health inequalities. The Underserved Communities Strategic Forum which includes representatives from all integrated care system partners, has committed to an action plan.
The starting point for forum members is a collective understanding of existing provision across the Black Country, followed by the pooling of resources and the formation of a system work plan to be driven by neighbourhood, place and system partners.
The Good Shepherd team, like many other frontline voluntary community faith and social enterprise sector partners, ensure people experiencing unimaginable injustices are cared for, feel heard and break down barriers to services. Thank you to everyone involved in the creation of this people-powered, feet on the street video.